the University. We're both students at the University of South Alabama. We are in the graduate school for clinical and counseling psychology, and we work with a neuropsychologist here at USA. So what we want to do today is just kind of talk about different ways that we can help improve our brain health for us, as well as try and encourage improving brain health for our loved ones that we take care of. Different kind of tips and tricks we can use to help compensate any issues that we may be having. And then at the end, we're also going to talk about kind of what neuropsychology is and why you might want to see, why you and your loved one might want to see a neuropsychologist, what they can help you with, and just kind of give y'all any answers to any questions that y'all may have about that. But I guess I can go ahead and get started. And the first thing that I really wanted to say is just that no brain injury looks like the other, right? I'm sure that y'all already know this information, but our brain is very beautiful and it's very complex and it's got so many things going on. And we have different areas that do different things. So depending on where our loved one may have gotten our brain injury, we may see different things happening whenever after they've had their injury. So an important thing to note is that there are some really important recovery milestones for individuals who have experienced a TBI. The first milestone is 3 months after post-injury, then 6 months, then 9 months. Those are typically the times where we see them make the biggest strides to after they've had their injury, the kind of improvements that we see. But we continue to see improvements in individuals' abilities after brain injury far past when they've had their injury. Recovery really never stops. It just requires some amount of work. And it can be difficult for our loved ones if that progress is slow, right? But sometimes we have to encourage them to keep at it. So we are going to be talking about a lot of different ways that we can encourage that growth. And before I do that, I want to talk about SMART goals. So I'm going to be going a lot of different ways that we ourselves can keep our brain healthy, but also encourage our loved one to keep their brain healthy. And they sound so easy at first sometimes, but when we actually try and integrate them into our life, it can be really difficult. So the best way to go about trying to encourage this growth is through using SMART goals. So SMART goals, SMART is an acronym meaning specific, measurable, action-oriented, realistic, and having a timetable to complete the goal. So a specific goal has a much greater chance of being accomplished than just a broad general goal. So when developing a goal, you really want to think about exactly what it is that you want to achieve and to what extent. And then for measurable, we want to make sure that we have this measurable goal in mind so we know that when we've actually achieved it, right? So the goal to be happy, how do we measure that goal, right? Just saying, I would like to be happy, that's not necessarily measurable, right? So we want to make sure that it's measurable steps that we can take. You need to be able to track the progress of your goal and be able to measure the outcome. And then action-oriented, this is stating your goal in a way that you are going to do what you say you're going to do. So a good statement of action should describe a result. And I am going to X, Y, and Z. And then for realistic, we want to make any goal that you set to be challenging, but also realistic. So we want to make these goals into small, if we have big lofty goals, we want to make them into smaller, more realistic goals, because the more that we're able to attain, the more we're able to build self-confidence in ourselves to move forward with our bigger goals. And then T, so the goal should be done within a time limit, because when we say just generally we have this goal, a lot of times we can let a long time go by without actually making steps towards this goal. So it's best to start with a short time frame for a very realistic small goal, and then monitor our actions and determine if the goal is manageable. And it's better to set a lot of short goals than one long goal. So just keep this in mind as we go forward. And wow, I'd really like my loved one to start engaging in that kind of stuff in their life, making sure that we're making it a smart goal for them to move forward. So how do we keep our brain healthy? One way is through physical exercise. So physical exercise is essential for maintaining good blood flow to the brain, as well as to encourage growth of new brain cells. So when we're working out our body includes our brain. So if we start working out, we're also not just growing arm muscles and stuff, we're also encouraging growth in our brain, new brain cells. And when we say exercise, we don't mean, going and being a bodybuilder and working out 3 hours a day. What we mean is making physical activity consistent in your life. This can look as short as 15 to 30 minutes a day of being physically active. And as long as you do something physically active consistently, any of that physical activity can be beneficial to our brain. We also want to keep a brain healthy diet. So research actually suggests that high cholesterol may contribute to stroke and brain cell damage. So we want to keep a low fat, low cholesterol diet, and have a lot of rich dark vegetables and fruits in our diet. This can protect brain cells when we do this. And then we want to remain socially active. So this has been really hard for a lot of us in times of COVID. And a lot of time after brain injury, it's hard for our loved ones to get out there after experiencing a brain injury. So it's really important to remain socially active in any way that we can to develop our brain and keep that activity going. And a really good way for our loved ones to remain socially active is by getting involved with that AHIP support group. It's a great way to remain socially active. And then having some kind of mental activity. So staying mentally active strengthens our brain cells and the connections that our brain cells have that connect them. So by mentally active, that just means any kind of activity that challenges us a little bit. So doing a puzzle or a word puzzle or a new game that we've never tried before, just trying to stay mentally active. And then it's also important to take medications as prescribed. And this includes telling your doctor before you change or discontinue a medication. So a lot of times people, they'll start a new medication and they don't like how it's making them feel, so they just stop. What we want to do before discontinuing is consult our physician, because that can really affect our brain, and they will tell us the right way to slowly get off of that medication. Especially after a brain injury, our brains are a little more sensitive to those kinds of chemical reactions. So we really want to make sure that we're consulting a physician before doing that. And we want to try and avoid tobacco, because tobacco, it constricts our blood vessels and can lead to other negative health effects that hurts our brains. And that also includes avoiding alcohol and drugs, because after a brain injury, like I said, our brain is just a little more sensitive to these things. And what used to feel like just one drink before may feel like 3 drinks now. So we want to make sure that we are being realistic about our alcohol use and our tobacco use. And then sleep. So people really underestimate how important sleep is for our brain health. It promotes cognitive efficiency. It helps us fight away groggy feelings. It helps us maintain good attention, positive mood, good reaction times. So much of our mental health and physical health and brain health relies on our sleep. So even if our society isn't necessarily telling us how important sleep is and getting the right amount of sleep is, our brain needs that amount of sleep. So what do I mean by good sleep? So good sleep looks continuous, which means not waking up throughout the night, getting 7 to 9 hours of sleep every night, and then feeling rested in the morning. So this means I wake up, I get on with my day, and throughout the day, I'm feeling rested. If this is not what your sleep or your loved one's sleep looks like, it's a really good idea to consult a physician about how to go about getting that good sleep and what might be affecting that. Some things that we can do to try and improve our sleep is through good sleep hygiene. So I'm going to talk a little bit about how we improve our sleep hygiene. But just remember that good sleep is so important and it leads to clear thinking and better memory. It's very, very important. So some things that we do want for sleep is we want to remove all light from our room, get some blackout curtains, making sure that there's no light being let in from a doorway. We want to reduce noise as much as possible. We can get sound machines, have white noise, or just some low playing instrumental music. We want to make sure our room is at a comfortable temperature for us. And we can engage in a bedtime routine. So something that's going to come up a lot with me talking about sleep hygiene is that our body reacts to what we're doing. So if we have a routine for before we get in bed, then our body knows, hey, this routine is happening. It's almost time for bed, and my brain is going to start getting sleepy and we're going to start shutting off for the night. Some things that we want to avoid. So 4 to 6 hours before bed. So that means if we're trying to get to bed at 10 o'clock, at about 6 o'clock, we want to stop doing these things. We want to stop intaking caffeine, nicotine, alcohol, or large meals. So a lot of people mistakenly believe that alcohol can lead to us having good sleep. So although alcohol may help you fall asleep more quickly, you're not going to get a restful sleep when you sleep. So try and avoid alcohol, caffeine, nicotine, and large meals 4 to 6 hours before bed. If you're feeling hungry in that 4 to 6 hours before bed, just snack lightly. And we want to avoid exercising or tackling stressful activities before bed. So some more do's for sleep hygiene. We want to only lie down when sleepy. So again, we want our mind to associate what our body is doing with sleep. So we want our body to know if I'm lying down, then it is time for sleep. So that way, whenever you get in bed and you lie down, your brain kind of gets the picture like, okay, it's time to start getting sleepy and go to sleep. We also want to only use our bed for sleep and only sleep. So that means, no studying in the bed, no playing games in the bed, watching TV, watching movies. Then our brain starts to associate these activities with our bed, our bedroom, and laying down. Instead, we want to keep our bed only for sleep. We want to get up if you don't fall asleep in 20 minutes. So this is something we really encourage people who experience insomnia to do. So if you've been trying to fall asleep for about 20 minutes and you're still not falling asleep, because we want to associate lying down in our bed with sleep, then we want to get up and get active outside of bed, and then try and come back later once we're feeling a little more sleepy. And we want to keep up that routine of getting up at the same time each day. Some don'ts. We do not want to stay in bed if you can't fall asleep when going to bed. If you want to wake up and can't fall back asleep, these are times when we don't want to stay in bed. We also want to avoid napping. Now, this is something that is good for the general public. However, a lot of our loved ones who've experienced TBI, napping is part of their daily routine. They need a lot of sleep. So if we are engaging in napping, we want to make sure that it is consistent and scheduled power napping. All right, so sometimes individuals after brain injury, they have a lot of problems with maintaining attention. So we're going to go through some good tips and tricks to kind of help our loved ones out with maintaining attention. So one of the first things is just breaking tasks into simpler parts, just one step at a time. We want to avoid multitasking. So we don't want to be putting the dishes away and watching a show at the same time. That's multitasking and dividing up our attention. We want to keep our attention on one thing at a time. We can rehearse steps mentally and or write them down. So if our loved one is about to prepare for doing something for the first time, or doing something that they're a little nervous about, or know that they have difficulty maintaining their attention in, a good way to prepare for that is to rehearse the steps mentally before going into that activity, and maybe even writing down the steps that they want to take while they're in that situation. And then they can also visualize themselves completing the task before completing the task. This will help them remember what they want to do when they're in that situation. And we want to make sure that they are taking breaks as necessary. So if they have just started school again and maybe studying has gotten a lot harder for them, making sure that they are allowing themselves to take breaks throughout. Another thing that we can do is use positive self-talk. So encourage them to talk to themselves about their progress as they go. So maybe they are trying to do their laundry and they forget to put the detergent away, or sometimes they make mistakes about actually putting the detergent into the laundry. We want to encourage them to talk to themselves as they're doing these tasks. This will help them maintain attention on the task rather than getting distracted by something else and going on to something else. So positively talking to ourselves of, okay, now I'm going to put the clothes in the washing machine. I'm going to take out the detergent. I'm putting the detergent inside of the washing machine, and that'll help them stay on the task at hand. So another thing is when we're having conversations with people, the way we maintain attention in conversations is by not being afraid to ask questions or paraphrase back to someone that we've heard what we wanted to hear. So, for example, if you're having a conversation and it's something that's really important to you, encouraging them to use this script of, hold on, this sounds important. Do you mind slowing down so I have time to think this through as you talk? Waiting for a second while I close the door, repeating what you just said, listening to see if I got this right. So this is a really good script to have handy if they're going into a situation that they know they want to make sure they get the information, such as talking to their doctor. All right, so some ways that we can actually improve our attention is by practicing mindfulness. So when I say mindfulness, that means the repetitive act of directing your attention to only one thing in this one moment. So that sounds really simple at first, but when we think about it, when we think about our day, a lot of the times we're going throughout our day and not actually thinking about what it is that we're doing. We're thinking about what we need to do next. We're thinking about what happened yesterday. So mindfulness is practicing bringing our attention back to the present moment and what you are doing in this one moment. And by practicing that over time, this has been shown to improve our attention abilities. So some good exercises to engage in to encourage mindfulness include mindfulness walks, mindfulness meditations, body scans, five senses. And if these are some exercises that you've never heard of before, just let me know at the end and I can send y'all some good resources on them. All right, so memory. Memory is another big complaint that we hear of after individuals have experienced a brain injury. So these are some things that we want to encourage our loved ones to engage in to try and aid in their memory. So a big one is just repeating themselves. So if someone introduces themselves to me saying, "Hi, my name is Sally," then I'm going to repeat that and say, "Hi, Sally." So repeating that information is going to help them remember. And then they will help themselves remember that name. We can create a story or a rhyme to give words more meaning. So, for example, a lot of times people have difficulty remembering Nanako's name. A lot of people have difficulty knowing how to pronounce her name. So let's try and put that to a rhyme to try and remember how to say her name. So we could say something like, "Hi, Nanako, nice to meet you." And then to ourselves, say something like, "Nanako, what does that rhyme with? Oh, Nanako, let's go to Monaco." And that way we always associate Nanako, Monaco, Nanako. I know Nanako's name. I know how to pronounce her name moving forward. That's going to help some memory tips and tricks of creating a story or a rhyme to go along with information. We can try and make a visual image in our head. So when I learn Nanako's name, I'm picturing the country of Monaco. We can also chunk information together. So a lot of people use this unknowingly when they're learning telephone numbers. So chunking it into that set of 3 numbers and then that set of 4 numbers. That is chunking information together to make it more manageable for us to remember. We can use acronyms like the one I just said at the beginning of today's presentation of SMART goals. Acronyms are a great way to remember things. And then also pairing a reminder with something physical. So for example, it's 9 o'clock at night and I'm thinking to myself, "Oh man, I really want to call my doctor in the morning, but I can't call them right now because it's 9 o'clock at night. So I need to do it when I wake up. How am I going to remember to do that?" So I can pair that reminder with something physical. So I know every morning I get up and I go to my coffee maker and make coffee. So I write down on a sticky note, "Call doctor," and I put that sticky note on my coffee maker. So that way, when I go to get coffee in the morning, I remember I wanted to call my doctor, and I can do that first thing in the morning when I go get my coffee. All right. The other complaint that we get sometimes with individuals who've experienced traumatic brain injury is disinhibition. So sometimes people experience a lowered tolerance of frustration with a tendency to anger more quickly because of our brain injury. So previous emotional controls are not always present like they were before experiencing a brain injury. So anger outbursts can occur, and these can be pretty explosive, but usually they're pretty short-lived. And people may express their thoughts directly, whereas previously they would have been more discreet. And so the first thing that we want to make sure that you'll know with disinhibition is that this is normal for individuals with brain injury. It's important to know that this is common for individuals with brain injury, and it's not something to be embarrassed about. It is something that we just want to have some tips and tricks, knowing how to move forward with what to do in response to these situations. So the first thing that we try and teach individuals who act out of, they can't inhibit themselves, is to stop and think and step back. So trying to count to 10 before acting on our impulses. Training ourselves to deliberately stop and think and step back before impulsively rushing into something or saying something that they might regret later. Something else we can do is keep a record or a notebook to identify situations where you think you may have been disinhibited. And that way you can kind of go back and look, am I more disinhibited in certain situations? Are those certain situations things I just need to prepare a little bit more for? It helps them to identify what the triggers are, and knowing this can help you put the brakes on the next time that you're in that kind of situation. And then we can also ask other people whom you trust to give you feedback. So really encouraging your loved one to ask you for feedback, ask their friends for feedback, other loved ones for feedback, to tell them when they are being a little bit disinhibited or being a bit over the top. And then also encouraging them to make their difficulties known to individuals, not hiding that information and not being too proud to apologize, right? Another thing that we can do is just pair when we're feeling disinhibited with a physical reminder. So if you are nearby in a time when they feel like I can't stop myself from outbursting, placing a hand on your shoulder to know I need to leave this situation right now. And that can just kind of be a gentle indicator to you that you need to leave this situation instead of immediately acting out of impulse. All right, so stress management is something everyone in the whole world wants to know more about, and it is no different for our caregivers, especially y'all, as well as our loved ones who may have experienced a brain injury. So the first thing to note with stress is that stress is there for a reason. Moderate levels of stress can actually improve our performance and efficiency, but too little stress may result in boredom. So stress is there for a reason. So our goal is not to eliminate stress altogether. That is not the overall goal of living. It is to find ways to manage our stress, because too much stress can cause unproductive anxiety, and it has negative effects on our health. So some ways that we can manage stress is by living a healthy lifestyle, which means those very beginning steps I talked about of maintaining a healthy brain, keeping a healthy brain. That means living a healthy lifestyle. Using time management strategies for ourselves. Goal setting with SMART goals that are small and manageable, and using relaxation strategies throughout our day. So one really great relaxation strategy that can be implemented into your daily life, takes no time at all, is just some deep breathing. And deep breathing really just includes breathing out for longer than you are breathing in. So a good way to do that is by telling yourself to breathe in for 5 seconds, hold your breath for 5 seconds, and then breathe out for 7 seconds. Including these small kind of relaxation strategies throughout our day is going to improve our health over time and decrease our daily stress. And then when these when these tips and tricks aren't working, pharmacological therapy, counseling, or psychotherapy is a great way to go out and get help. So that brings me to my next slide of not being too ashamed to go out and ask for help. So getting in contact with Bethany or Amy about AHIP services, for knowing where to go for a therapist for you, for your loved one, for a psychiatrist, going to the website psychologytoday.com. That will tell you who's in your area, as well as any kind of telehealth providers that will be around, and asking which providers are covered under your insurance. So a lot of times when we talk about therapy and engaging in therapy, people worry, well, I'm not doing anything wrong, right? I'm not crazy. My loved one's not crazy. The important thing to know about therapy is that a lot of therapy has changed from what it was originally. It's no longer sitting in a room and laying on a couch and talking, right? It's more about having someone there who's going to help you achieve the goals that you want out of your life. That is the way that therapy is moving forward. So it can help you, it can help your loved one, and it can help both of y'all together in y'all's relationship. But now I'm going to go ahead and turn things over to Nanako, so we can talk a little bit more about what neuropsychology is and what a neuropsychological evaluation entails.
So hi, everyone. I know Jasmine introduced me earlier. I'm Nanako. I guess I'm going to have to ask you to go to the next slide. You're controlling the slideshow. All right, so when should we consider a neuropsychological evaluation? So a neuropsychological evaluation is a really great resource for kind of telling us more about cognitive and psychological effects of neurological or medical disorders. So this includes kind of any TBI or brain injury. So a broad definition of neuropsychology is that it studies the relationship between our brain and behavior. And when I say behavior, these could be like actions that we do, but it also refers to our cognitive functioning and our emotional functioning as well. So again, neuropsychology looks at our current abilities in general, and it can give us an insight to how we're functioning. I think you can go to the next slide. Okay, so what is a neuropsychological evaluation? So neuropsychological information can be really helpful to determine which areas of functioning may have been impacted. So during an evaluation, we use a lot of different tests to look at different domains of cognitive functioning. So this can be attention and concentration. How well are you able to stay vigilant, stay on task, and attend to different things in the environment? We also look at learning and memory. And memory in itself can be broken down into different subtypes. So often we look at working memory, or the ability to take in information and manipulate it in your mind. So kind of simple math is a great example of this. So if I told you to take 5 plus 2 and subtract 3, visualizing those numbers and doing that calculation in your head is an example of working memory. We also look at visual memory. So how well can someone kind of remember pictures or different drawings? And then we also look at verbal memory. So often this is in the form of how well do you remember a list? Or if I tell you a story, how many details can you repeat back to me? Another area that we look at is processing speed. So this is kind of the way we take in information and make sense of it quickly. We look at mental flexibility. This taps into kind of problem solving skills and the way we use logic to solve problems. Language. So there are certain kind of areas in the brain that are highly associated with language. So certain tests of language can kind of tell us if there's maybe damage in those areas, or the way someone is even just speaking and communicating with us can indicate damage or dysfunction in a certain brain region. And then we also like to look at personality and mood. So one thing that a neuropsychological evaluation is really good for is making distinctions between medical and mental health causes of dysfunction. And certain disorders have a lot of symptom overlap. So ADHD and anxiety, for example, have a lot of symptom overlap and they could look very similar to someone. So a neuropsychological evaluation can kind of help us get to a more accurate diagnosis and parse out like why we're experiencing certain types of issues. A neuropsych evaluation is really great for noticing changes over time. So anyone who's experiencing changes in thinking, problem solving, kind of the list that I went over earlier, attention and memory, performance at school or work, or even emotional and behavioral functioning is a really good candidate for a neuropsych evaluation. So again, the evaluation can help uncover reasons for why a person is struggling, and it can also help with finding ways to improve on those areas. Neuropsych evaluations can give us some information on determination of disability and competency, can also help guide decisions for need of guardianship or the ability to return to work or school activities. It's going to give us a lot of information about determination of treatment needs. And again, it's really great for monitoring the effects of treatment over time, as well as change over time. I think go ahead and go to the next slide. So who should you see for a neuropsych evaluation? So the website that Jasmine shared, the Psychology Today, I believe also has some resources, but ideally you want to see a clinical neuropsychologist, a licensed clinical neuropsychologist, and they will be at a doctorate level. So this could be a PsyD or a PhD. And so during the course of an evaluation, typically you will go in for an intake interview. It's usually the first step. During this interview, you will sit down with the neuropsychologist and share the kinds of troubles you've been noticing, issues you've been having with functioning, as well as a lot of details about your history, medical history, kind of social factors, where you grew up, educational and vocational history. So by the end of that interview, that neuropsychologist is going to know a lot about you and how you're functioning. So then next would be kind of the testing part, and those will be different tests. I like to think of them as games sometimes. It makes the time a little more enjoyable, but those will go over the different cognitive domains I mentioned earlier. So memory, attention, processing speed, things like that. And then at the end of the evaluation, there's typically some downtime where the neuropsychologist is going to take all the information they gathered from that day and write up a report. And then you will receive a report and hopefully in a few weeks' time that explains kind of goes over the issues that you described with the neuropsychologist, and it should include your history that you shared with them. They will go over the results of testing and interpret those results for you. So they will tell you kind of what they learned from the testing. And ideally, they'll give you some areas of strengths and weaknesses and provide you with some recommendations for how to proceed. And this could be for different accommodations for school or work. And hopefully with those recommendations, they can point you in the way of some resources. So I think that's the last slide I have. So I wanted to open it up and leave some room for questions.